It's interesting, one of the things you were talking about with kind of going and feeling things out, because I had some injuries and I was doing a seminar up in Northern California, and there was a guy I was following. I was like, I got to go see this guy. And I went in and I sat down and he didn't ask me anything. He just started doing stuff. And I was like, hey man, like, don't you want me to tell you what's wrong with me so you can fix it? And he was like, I don't need you to tell me. Your body's going to tell me. And dude, guy, I left there. I felt amazing. And that was Dr. Peter Goldman. And that like actually turned me on to like, I started listening to his podcast, dude. And I heard him like, Kurt Osiander, he was working on and stuff. But I heard that he was, part of the influence on you too. So I'd love to talk to you a little bit
Yeah.
about the chiropractor side too, because it's one of those things that I think gets a bad rap if you've gone to a bad one. But I'll tell you, like the zone stuff he did was incredible. And the people that I've gone to that do ART have been game changers for me, which most people, they don't understand that there's different things different chiropractors do. But those have been two of the things, like as an MMA guy and a jiu-jitsu guy over the years, there's times I'm driving home from the gym and I'm like, I don't know if I can train anymore. Like I can't move my neck. And then that afternoon, I'm like, I can go back to class tomorrow because of what this person just did.
Yeah, so Dr. Pete Goldman, man, he's the reason I became a chiropractor, actually. It was 2013, 2014. My sister lived in San Francisco. She was in school there, and I lived in Chicago. And my neck as a blue belt was just messed up. I mean, I'd been training a lot every day, a couple times a day, 3-4 times a day sometimes, like morning, noon, and night, and then squeeze in another session. And my neck was so destroyed after a couple of years, barely making it to class. And then my instructor, Adam Redzovic, he had been out to the Bay Area, and I saw him. He'd posted something with Dr. Pete, and I'm like, hey, how's this Dr. Pete Goldman guy? Like, is he any good? Because, like, I'm going to go visit my sister for spring break. Like, I'm in bad shape, man. Like, I don't know, like, I've never seen a chiropractor. He's like, oh, this guy's the man. I'm telling you, like, go see him. I'm like, all right, if you say, and he's a black belt, okay, let me go check him out. And it turns out, Pete's also not only a black belt under Carlos Tapao, but he's a very high-level Kyokushin karate guy. Just kind of a side note. But then, so I went and I saw him. One appointment, man. One appointment. I mean, my neck was fixed. Like, I got up, like, deep breath, like, holy crap, like, what just happened? And that was kind of it. I mean, at that point, I was already studying to be a dentist and had all the sciences and stuff. And I haven't done a year in dental school. That's a whole nother saga. But then eventually dropped out and went to chiro school. I was like, dude, this is the real stuff, because it's like, I'll enjoy this. Like, I mean, the guy makes, does well for himself. You're still a doctor. And then, I mean, look, I grew up in a family of doctors. We got 4 MDs in my family. Like, if you want to talk about an expectation, Persian upbringing, Iranian, like kind of, this is what you're going to do with your life, like, be a doctor. Like, I don't compare my life to anybody else's. I'm just going to tell you that's how it was for me. Like, I didn't really have much of a choice, but I hated a lot of what I was doing. But chiropractic was the first, like, science-based thing that I'm like, I could do this. I really like this. And that ties right into jiu-jitsu. And I was like, screw it. I mean, I ended up going to chiropractic school, finishing up in California. I did a couple years in Chicago before realizing the weather sucks here. And, every one of my trips, every one of my vacations, spring break, summer break, whatever little break I had, let me go to California, let me train. Let me go get a week, find an Airbnb somewhere, San Diego or LA or whatever I had to do to just get out here. And I'm like, what am I doing? Like, coming out here for vacation when, like, this is all I want to do. Like, I didn't move here, right? So fortunately, and surprisingly straightforward process transferring my courses for chiro school between Chicago and California. But the thing that really set Dr. Pete apart was the zone technique, right? And I became certified in this the first thing I did in chiro school. So the zone technique is just this way of basically understanding that the body is split up into 6 different systems: the glandular system, nervous, digestive, muscular, circulatory, and eliminative system. And based off kind of the brainstem and based off kind of reading the neck, reading the back of the head, you can start to see what parts of the spine are short-circuiting, right? Because all we are is this big electrical machine that's the human body. The brain is the positive pole of this electrical machine, sending motor signals down to the fingers, down to the feet, down to every cell in our body, and sensory signals are coming up the other way, right? So it's a two-way circuit. Every cell in our body is the negative pole of this electrical machine that's our body, and the brain is the positive pole, and we just have wires connecting them. Now, anytime we get pain or numbness or tingling or hyperspasticity or, different things, we can link it to a short-circuiting going on in that chain, right? And Dr. Pete, through his zone technique, he kind of showed me that the most precise chiropractic technique you're ever going to need for the adjustment, for the chiropractic adjustment. To this day, I mean, going all through chiro school, I was blown away at how the zone technique just blew everything out of the water. I'm like, there's nothing that they taught us in school that even comes close to the effectiveness of what I learned from Dr. P. Took a seminar like the first week of chiro school, like I was already getting certified in his stuff. And to this day, I mean, I work a couple times a week, part-time, just, semi-retired sort of thing, like in my chiro office. All I do is zone technique. It's literally the only thing I do for adjustments because it's so effective. It kind of gives me a whole baseline of how the person needs to be treated, and that's it. You could get on the table, go face down, let me do my thing. Let me just make sure any surgeries, all right? Any surgery, all right? No surgeries, all right, fine. And that's pretty much it. And ART, active release therapy, this is the preeminent, like the most dominant, like soft tissue technique that I engage in. Now, the generic name for it is muscle release technique, MRT, right? The active release technique is a patented name, right? But it's the same thing. So muscle release technique, the idea of pinning and stretching a muscle against resistance, understanding how the interlocking fibers of your muscles work. The muscle knots is just really tangled up muscle fibers, right? On a really microscopic level, you'll see things kind of twisted up and turned up. And ART, there's some videos on like YouTube. The Dr. Hightower guy does that a little bit, but I'll do it occasionally with patients. We're an adjustment only clinic for the most part, but if someone's like really, really tight or one of my personal patients, then I'll do a little bit more muscle work. But yeah, we put a muscle in a shortened position, we pin it, and then we stretch it against that resistance into its lengthened position. And you will be surprised, I'm sure you've experienced it, but you'll be shocked at the results that people will get where, okay, that's the number one treatment for tennis elbow or golfer's elbow. It says, I just do some ART on the arm, man, you're going to feel like 80% better instantly. Where frozen shoulder, I'm always kind of like hitting a little ART there on the levator scap, the trap, the deltoids, just kind of hitting all the regions in that area. And, if something's kind of congested and tight, right, ART is it's a non-invasive way to start to open things up. Everything I'm interested in as a chiropractor is like, how can I do things with my hands? As Dr. Pete has taught me, chiro means hand, practic means practice in Greek. The practice of the hands, it's all I should be using if I'm a true blue chiropractor, right? Now, there's a lot of, equipment you can use. I go to a little clinic here that has a hypobaric chamber, has a, red light sauna, red light therapy. That's not chiropractic, right? It's all good stuff. I use hypobaric chamber. If you have a cold laser that you could use, it kind of helps loosen up the ligaments maybe in different areas. It's not technically chiropractic because it's not practice of the hand. And there's a lot of chiros that they do have a lot of gadgets at their office. And again, I'm a student of Dr. Pete, and sorry, we have this surf liner, this train that comes by, but I'm a student of Dr. P, and he says, hey, listen, I'm not going to take a crap on anything that has results. If it has results and it helps people, it's great, to each their own. And the results with zone technique have been phenomenal. It worked on me. I'm sure you felt it. And, I have patients come in all the time. I take a quick look at their chart, just make sure, okay, no crazy red flags, all right? And, really out of courtesy, I'll just ask them, hey, what are you dealing with a little bit? And they say their right hip, their left shoulder, their mid-back, whatever they say. And I really don't even need to ask. I can just feel it. They'll say something and I'll just put my hand, do my quick assessment and this thing is just like twisted up, but it's kind of common sense. You start to see the grid that is the human body. You start to see the way that, normal should look like. And this was a big thing in chiro school. It's like, okay, here's normal anatomy. And then what is abnormal anatomy? What is something that, okay, you look at their thing, they don't have a genetic abnormality, so that thing's sticking out. Oh, yeah, that's a misalignment, right? So, again, I say this to people. You could teach a monkey to adjust, but it takes you can show anybody to adjust. I can give me 10 minutes, 5-10 minutes. I'll show you how to serviceably do a couple adjustments on someone, and you'll be like, oh, okay, I can do it. But I think the whole thing is to get a license, you got to learn when not to adjust. You got to learn like all the science behind anything that could step up on to that table. I've learned so many things, so many conditions that have never popped up in clinic, that are so obscure. All these like rare things that reasonable to think like you probably won't see most of this in your life. But hey, like first week on the job here, I never thought, in 4 years of chiro, I'd never seen a woman with a scorpion bite. And then first week I saw someone with a scorpion bite. And I'm like, okay, scorpion bite. And then she's like, she can't feel her legs. And she's like, it's been like this since the bite. I'm like, oh, wow. So I had to like look back and see like, how scorpion venom can actually affect the peripheral nerves in the human body. Like this was a new thing for me. I don't know this off the top of my head. So I'm like, okay, so there's a very interesting history, right? To realize that nothing I do on her legs, her feet, her knees are going to bring back that sensation to the left. Like, I don't know if a hip adjustment is going to do it for her. If I just kept thwacking, come on, do you feel your legs yet? Do you feel your legs yet? Yeah, I don't know if that might be malpractice a little bit, right? Like just to overdo it. But so I think like just to be able to read a chart. I mean, our California board exam, a lot of it was like, did you read the history? You know, like did you read what's going on with this patient? Because like 20-30% of our exam was a raw adjustment exam. It's like, hey, you come in, you set up like this, you put your hand here, you do this, you do this, you do that. And that was like the adjustment portion. But a lot of it was like, did you read the history? Did you read about their blood pressure? Did you read about their medication that would tell you, that they're dealing with these issues? Did you read about their family history, their surgeries, and contraindications? So I think just being a competent kind of clinician kind of is based off that. But man, I mean, Dr. Pete Goldman, I don't know if he has his old website, still sfgoldman.com, because I think he's just doing zone technique. I think he moved to Tennessee during COVID. He was in San Francisco for many years. But yeah, he was my number one influence. He's who I got my certification under, the zone technique, which is separate from the actual Doctor of Chiropractic degree, which I get from an accredited school, right? And it's the only way I practice. I mean, it got me into it. It worked on me. I do it on patients. It works on them. My patients love me. And for me, it's like a really, really easy way to practice for the rest of my life.